Ever found yourself pondering over what anorexia nervosa is? Well, today we're going to dive into this topic. Anorexia nervosa is a severe eating disorder characterized by self-starvation and excessive weight loss. It affects millions of people worldwide, with a higher prevalence among young women. According to the American Psychiatric Association's Diagnostic and Statistical Manual 4th edition, text revision or DSM-IV-TR, there are 4 key diagnostic criteria for anorexia nervosa. Firstly, a refusal to maintain body weight at or above a minimally normal weight for age and height. Secondly, an intense fear of gaining weight or becoming fat, even when underweight. Thirdly, a disturbance in the way one's body weight or shape is experienced. Lastly, in postmenarcheal females, the absence of at least 3 consecutive menstrual cycles, though this criterion has been removed in DSM-IV. Anorexia nervosa is a complex and challenging condition, but understanding its diagnostic criteria can help us better comprehend it. Now that we know what anorexia nervosa is, what are the DSM-IV-TR diagnostic criteria? The DSM-IV-TR, or the Diagnostic and Statistical Manual of Mental Disorders 4th edition text revision, is a manual published by the American Psychiatric Association. It outlines the standard criteria used by mental health professionals worldwide to diagnose mental disorders. For anorexia nervosa, there are 4 key criteria listed, labeled from A to D. Criterion. A refers to a refusal to maintain body weight at or above a minimally normal weight for age and height. This could manifest as weight loss leading to maintenance of body weight less than 85% of what is expected, or failure to make expected weight gain during a period of growth, leading to body weight less than 85% of that expected. Criterion B is the intense fear of gaining weight or becoming fat, even though the individual is underweight. This fear can be so overwhelming that it drives the person to extreme measures to prevent weight gain. Criterion C is a disturbance in the way one's body weight or shape is experienced. This could involve undue influence of body weight or shape on self-evaluation, or denial of the seriousness of the current low body weight. In other words, the person's perception of their body is extremely distorted. Finally, Criterion D applies to postmenarcheal females and involves amenorrhea, which is the absence of at least 3 consecutive menstrual cycles. However, it's important to note that this criterion has been removed in DSM-5, the latest version of the manual, as it was recognized that anorexia nervosa can occur in individuals of all genders. In essence, these criteria are used to identify and diagnose anorexia nervosa. They may seem technical, but they are crucial in understanding the complexity of this disorder. Medical professionals use these criteria to ensure they can accurately diagnose and therefore provide appropriate treatment for individuals suffering from anorexia nervosa. These criteria, although technical, are fundamental in diagnosing anorexia nervosa. Did you know anorexia nervosa is not just one type? It's true. This complex disorder actually manifests in 2 distinct forms: restricting and binge eating/purging. Let's start with the restricting type. This is perhaps what most people picture when they think of anorexia nervosa. Individuals with the restricting type maintain a dangerously low body weight by severely limiting their food intake. They do not engage in binge eating or purging behaviors. On the other hand, those with the binge eating/purging type of anorexia nervosa also maintain a very low body weight, but they do so through a cycle of binge eating and then purging. Purging can take various forms, such as self-induced vomiting, excessive exercise, or the misuse of laxatives, diuretics, or other medications. While both types share a fear of gaining weight and a distorted body image, the behaviors they employ to control their weight differ significantly. With this understanding of the types, we can better identify and tackle anorexia nervosa. Anorexia nervosa, although a severe disorder, can be managed. Both outpatient and inpatient programs are available, the choice of which depends on the individual's condition. Inpatient hospitalization for treatment of eating disorders is rarely on an acute basis, unless there is a concurrent psychiatric reason such as a risk of suicide. The management process begins with agreeing on a target body weight on admission, and providing reassurance that this weight will not be surpassed. Psychotherapy plays a crucial role in addressing food and body perception, coping mechanisms, and the potential health effects of the disorder. Monitoring for complications of anorexia nervosa is a vital part of the management process. One such complication is refeeding syndrome, a potentially life-threatening metabolic response to refeeding in severely malnourished patients. The prevention of this syndrome includes slow refeeding, a gradual increase in nutrition, supplemental phosphorus, and close monitoring of electrolytes and cardiac status. With the right management and support, recovery from anorexia nervosa is possible. Anorexia nervosa is a serious health concern, but understanding and awareness can make a difference. We've examined its diagnostic criteria, specific types, and management strategies. Subscribe, like, and share this video to spread awareness about anorexia nervosa. Your support could make a difference in someone's life. Stay tuned for more enlightening videos from Medicine Health 360, where we make complex medical knowledge accessible for everyone.